Are you concerned about speech delays and/or excessive tantrums? Maybe someone has told you that this is all just the terrible twos or the terrible threes, but you're worried that it might be something more serious. In this podcast episode, I'm going to discuss 3 do-it-yourself easy assessments that you can do with or without any confirmed delays, with or without any professional help, or while you are waiting in line for additional evaluations and therapy. So let's get to it. Okay, today I'm excited to dive into 3 easy assessments you can do with any young child ages 1 to 5, those with and without confirmed delays, diagnoses. These assessments will help you find your child or client's strengths and needs, and it will also provide clues so that you know what to work on to help your child starting today. There is no sense blaming things on the terrible twos or the terrible threes. Young children who are over the age of 18 months should not be crying, screaming, having major problems throughout the day. Even if they have a diagnosis of a speech delay, even if they have a diagnosis of autism or something else, there is no reason that we should accept crying, screaming, and other problem behaviors to be a part of any child's life. There are easy assessments and there are easy techniques to help you turn things around. And I should know because I've been in this world helping parents and professionals for over 25 years now. First, as a registered nurse and very confused mom when my firstborn son started showing speech delays and early signs of autism that I missed. And also as a board certified behavior analyst and online course creator. So I know what to do. We actually are rebranding and expanding our mission to help all young children with or without any confirmed delays. But when I see people blaming things on the terrible twos or terrible threes, or blaming things on the fact that their speech delayed, so obviously they're not going to be able to communicate and they're going to throw a fit, that doesn't have to be the case. Just because a child is speech delayed doesn't mean there aren't other techniques you can teach them to communicate well, even if they don't have any vocal language yet. So let's get into our 3 do-it-yourself assessments that you can do today. And make sure you check out all the show notes at marybarbera.com/278. At the very bottom, you'll see show notes of these different assessment forms that you can see samples and you can see the blank ones and be able to download those so you can hit the ground running. Okay, assessment number 1. Wherever your child or client is at, it is best to get a language sample. This is an assessment. We set a timer either for 15 minutes, 30 minutes, or even an hour. I usually recommend a 15-minute session where you set a timer, you sit in the same room within arm's distance away from the child, and you write down any sounds, words, word approximations, or phrases. Now, a common question is, well, how much should I interact with the child during this language sample? And the answer is it depends. So if I have a child that hardly ever talks, hardly ever says words, doesn't babble much, whatever the situation is, if a child is not producing a lot of sounds and words and word approximations, you're going to want to be involved in trying to get some words out during this short language sample session. So you'll probably want to try to engage them in other activities that you know have produced some language in the past. bouncing them on a ball, blowing bubbles, saying words like pop and bubble, and engaging them with the activities during this 15 minutes may produce 1 or 2 word approximations or even sounds. You'll want to note what location you are in and how much you are engaging your child. If, however, you have a child who is producing words or even short phrases, you might want to sit back, pretend that you're on your phone or writing in a journal, and have the child engage with you, and you can really assess spontaneous language. Or if you're unsure, you can do a 15-minute language sample with you not engaging and a 15-minute session engaging with the child. This doesn't have to be a once and done thing. In addition to counting sounds, words, word approximations, and phrases, you can also look for clues as to what materials you can begin to gather. Hey there, it's Mary breaking in real quick here to share a great free resource. Tens of thousands of parents of young children have already completed the free 10-minute digital assessment that I created. If you have a short amount of time, 10 minutes, go to marybarbera.com/assessment to find your starting point to help children with and without delays or autism. Once again, go to marybarbera.com/assessment. Now let's get back to the show. So if the child says mama as he's with you and he's saying mama to you, you should definitely have pictures of yourself for our early learner materials, such as the shoebox or matching activities. You're going to want to say they say baba when they look at a sheep, or just baba in general. You might want to then have a few pictures of a sheep so that you compare the sound baba, because vocally they can say it. So the number one assessment you can do starting today, with or without my actual form, you can even do this on a loose leaf or on your notes app on your phone, is you want to set a timer for a short period. I recommend 15 minutes. Note where you are, how much you engage your child, and write down all sounds, words, word approximations, and phrases. The second assessment that you can do today is to record short videos. We want to record 1 to 2 minute videos of a child alone playing with toys, not noticing you're videoing them. You want to sit back, make sure you're close enough that you can see what they're doing. If they talk at all, you want to note that, but you're not engaging with the child during this 1 minute video. You're just simply recording them by themselves. So some videos are just kids playing with trains around tracks, or lining things up, or labeling things to themselves. Whatever the situation is, you want to just get a minute video of an alone condition. The second video you definitely want to get is you engaging the child. So you might need to set up a tripod, or just balance your phone somewhere handy that it can record the 1 minute session, or get another adult to record while you're trying to engage your child at a table or on the floor. So these short recordings will really be helpful in looking back and seeing your child's progress. Also, weekly or monthly language samples, or even daily at times, might really help you continue to gather clues and continue to see what activities produce the most vocalizations. And the third and final assessment that I'm going to talk about today, I have more assessments and more procedures in my online courses and community. But the third assessment you can do is you can complete the Barbera Early Childhood Assessment, which we call the BECA. This is a digital assessment. It's newly named. It was not called the Barbera Early Childhood Assessment until about March of 2024, when we renamed it. after seeing the results from tens of thousands of parents who completed the assessment. It used to be called the Turn Autism Around Assessment, but our data show that the vast majority of the parents who've taken the BECA, or previously called the Turn Autism Around Assessment, actually more than 85% of them did not have a diagnosis for their child when they took the previously named Turn Autism Around Assessment. But they still had deficits and needs in the area of self-care, language and learning, and they had high rates of tantrums and other problem behaviors. So with that data, we've revised the assessment, and we actually are in process of having our first cohort go through the Positive Toddler Parenting online course. So we have made some big changes, including the name of this podcast, the name of the digital assessment, and the addition of our Positive Toddler Parenting course, because I know, after being in the autism world for over 25 years, that these procedures work great for kids with autism. They work even better if the child does not have autism. And I want to get these proven strategies, child-friendly, positive, proven strategies out to the world. So the BECA assessment takes 10 minutes to complete. You can get it for free. It's still free at marybarbera.com/assessment. I am considering making this a paid product soon. So you want to go on marybarbera.com/assessment now, while it's free at the time of this recording, and complete the 10-minute digital assessment. It will give you scores in terms of a snapshot of your child's development, with scores in self-care, language and learning, and problem behaviors. This will provide the starting point, and then in a few months, you can take the assessment again to hopefully see progress. You'll actually get a printout of PDF of your child's assessment as well. And this is where you learn how to take the assessment and find your child's strengths and needs, which we're going to go over in next week's podcast, how to take the assessment and turn it into a plan. But this assessment really is quite the document, because even if you have reams of assessments and evaluations, recent ones, this will provide a snapshot of the main areas and will help you see really how you can use your child's strengths to improve their needs. So the 3 assessments you can do today is the language sample, the 2 baseline videos, and the BECA digital assessment. I'm going to link everything in the show notes, so you can make sure you go there. And ideally, you should observe progress in all 3 of these assessments over time. And if you're not seeing improvement or progress, or if you're only seeing minimal improvement in whatever kind of therapy you are doing, it may be necessary to really look at the intervention that you're providing your child. Don't blame it on the terrible 2s or terrible 3s. Your child may not need a diagnosis, but you do need to learn what to do to help turn things around. In general, as I said, children ages 18 months and older should not be crying or having major problem behaviors on a daily basis. They should be talking, they should be imitating, playing, sharing, and adjusting to daycare or preschool. You should be able to take your toddler of any age or ability level with any diagnosis to the store, to the playground, or to the doctor's office without major issues. So if your child is having terrible 2 type of tantrums on a regular basis, there are probably speech and language delays and or sensory issues that are impacting their behavior. You can learn positive and preventative toddler parenting strategies right here in the podcast and within my online course and community, which will open again soon. So I encourage you to take a look at these 3 assessments to effectively get a snapshot of your child's language skills, their tantrums, their self-care needs. Don't blame problem behaviors at home, at school, or in the community on the terrible 2s or terrible 3s, or on the child's diagnosis or disability. You can turn things around. In next week's podcast, as I said, we're going to be taking the BECA assessment and showing you how to find your child's strengths and needs and to develop a 1-page easy plan. So I'll see you back here next time, same place. And I encourage you to subscribe anywhere you're listening, and also to subscribe to my email list so you'll get email notifications when our next podcast comes out. You can always go to marybarbera.com/podcast to check out this episode, previous episodes, and upcoming episodes as well. So I will see you next week. Till then, have a good one.